The U.S. Preventive Services Task Force issued the CAT scan recommendation after a large clinical trial of more than 50,000 smokers showed screening with CAT scans instead of x-rays resulted in a 20% lower risk of death from lung cancer. Here with further details are Deborah Kelly with the American Lung Association in California and UC San Diego lung cancer specialist Dr. Phil Montgrain. Welcome.
Thank you.
Thank you. Deborah, give us a snapshot of where we stand right now in the U.S. with lung cancer.
So lung cancer is the leading cancer killer of both men and women in the United States. And in 2012, lung cancer killed about 160,000 Americans. And to put that into perspective, it actually kills more people than breast cancer, pancreatic cancer, colon cancer, and prostate cancer combined.
And that's one of the reasons for these screenings, I understand, Dr. Montgrain. The American Cancer Society and most of the medical community I've seen so far really supports this recommendation. Specifically, according to these guidelines, who should get these CT scans for lung cancer?
So the recommendations are to screen patients with annual CAT scans who are heavy smokers, who are aged 55 to 80 years of age, and they define heavy smokers as smoking 1 pack a day for 30 years or the equivalent of that amount. So that could be 2 packs a day for 15 years. And it's for current smokers, but also people who have quit. And if they've quit, it has to be within the last 15 years.
And if they do just go to their doctor to say, look, I want to follow these new regulations, how do they go about this?
They should have a discussion with their physician, talk about the risks and benefits and whether they meet criteria for screening.
Well, one question that comes to mind is under the new Federal Health Care Act or Obamacare, insurance companies are supposed to cover this cost of a CAT scan, which I understand runs between $300 and $400. Why not use a less costly screening method like x-rays?
That's a very good question, and we've actually answered that question. When a large trial called the PLCO trial studied 150,000 patients comparing chest x-ray to no screening at all. And that study showed no difference in lung cancer mortality. It didn't even show that chest x-ray could not detect cancer at an earlier stage. So we now know that chest x-rays don't work, but luckily we know that CAT scans do work.
And we'll come back to why it's key to catch these early. So basically the x-rays were not catching lung cancers at early stages, correct?
Not sensitive enough to do so.
I see. Now, Deborah, compared to other cancers, as you were talking about, lung cancer does have a high death rate. What's the ratio between smokers and lung cancer?
So lung cancer is a disease predominantly of smokers, so about 85 to 87% of cases are in smokers, and the remainder of the cases are in non-smokers.
Okay, and there's other health things that can cause actually fatalities that smoking is linked to as well.
Yeah, smoking is linked to lung cancer and 10 or 11 other cancers. It's also linked to heart disease and stroke, and of course it's linked to a lot of chronic lung diseases like emphysema and bronchitis. So there are a lot of ways to die from smoking.
Okay, and Dr. Montgrain, there's been some advancements in lung treatments for lung cancer, I understand. Tell us how it's treated and kind of the direction it's going in.
So a patient's best chance of cure with lung cancer is surgical removal of a lung cancer. And that can be done in stages where the tumor has not spread to other parts of the body yet. So that's the hope with this screening, that we'll catch tumors early enough to remove them surgically. When the tumor is more advanced, usually treatment is a combination of chemotherapy and radiation therapy. And recently there have been advances in lung cancer treatment that are very encouraging. There are these targeted therapies that target specific molecular genetic mutations within the tumor. So lung cancer is moving towards a more personalized approach. Rather than kind of a very kitchen sink approach, we are going to target specific abnormalities in a tumor.
And you can do that with a pill, correct? There's a pill that's out now.
Yes.
Or coming out?
Most of these targeted therapies are oral pills that you can take, and they're quite well tolerated.
Some promising work there. Deborah, how effective are cessation programs, and what would you like to see change in light of this screening program or recommendation?
Well, quitting smoking is still the best thing we can do as far as preventing lung cancer, and there are a lot of methods out there to quit. We would direct people to look at the lung.org website. There are a lot of resources out there, but I think most importantly we want to be sure that these screening programs incorporate advice about quitting smoking.
Okay, and on this note, we'll have to end, Dr. Montgrain. What about critics who say, listen, this screening is going to cause some false positives? What's the downside to it?
Well, there are some risks, and I think what you mentioned, false positives, is probably the biggest risk. We know that over a quarter of these scans will be positive, and the overwhelming majority of those will be false alarms. So that does carry some risk because some of those patients may end up getting invasive procedures or biopsies that they didn't otherwise need. But we have to balance those risks against the lives saved by screening for lung cancer.
All right. Dr. Phil Montgrain and Deborah Kelly with the American Lung Association, thank you both so much.
Thank you for having us.
Thank you.